attend to them and we send out those meetings. Before we continue, I just wanted to announce again that this session will be recorded. And just to make a very brief disclaimer on behalf of FEM, so the views and opinions that will be expressed today in this webinar are not those of FEM and should not be considered as advice. The views expressed do not necessarily reflect the official policy or position of FEM. FEM will not be held liable for any damages, and attendees should use the information at their own peril. All right, so very briefly, today's agenda, Dibuo will start with the opening and welcome, our FEM CEO. She'll then hand over to Dr. Azwi, who will be followed by Dr. Jenny and Sophia Joseph, talking through the different themes. And then I will come back at 11:15. I will close, take the last rounds of questions, and that will be the end of our session. So without any further delays, I will hand over to Ndibuo, then our program will start. Thank you so much.
Thank you, Norma, and good morning, everybody. It is my pleasure to welcome all of you to our webinar this morning. For those who are not familiar with our organization, as FEM, we provide workmen's compensation cover to the construction industry. We've been in existence since 1936. So in fact, this is our 85th year in existence. We operate under license from the Department of Employment and Labor alongside the compensation fund. So if you're in the construction industry as an employer, you've got an option of either taking out your workmen's compensation cover with FEM or with the compensation fund. We are proud to say that more than 6,000 construction employers have entrusted us with providing workmen's compensation cover for their employees. And that covers around about 300,000 employees. I think it's fair to say that COVID-19 has had an unprecedented impact on the world as we know it. We have all been affected in one way or another. And sadly, in certain instances, we have had to face the tragedy of losing loved ones. And for that, from an FEM perspective, we really do extend our heartfelt condolences to all those who have suffered losses. The world of work has also been impacted, both in terms of livelihood and also in terms of how we as employers have had to revise or review our focus in terms of how we keep our employees healthy and safe in the face of this pandemic. This is also an opportunity for me to just remind everybody that COVID-19 is deemed to be a compensable disease in terms of the Compensation for Occupational Injuries and Diseases Act. So if there is a work-related COVID-19 incident, please do ensure that that gets reported through to the appropriate entity, whether that's ourselves as FEM, the compensation fund, or RMA for the metal and the mining industry. To date, across all three of the entities, we have received in excess of 25,000 reported workplace-related COVID-19 incidents. From an FEM perspective, in excess of 500 of those 25,000 incidents have been in relation to our policyholder base. And we've accepted liability for around 43% of those instances. As FEM, we do believe that vaccines are key in ensuring that we can get through this pandemic. To that end, we have committed to assist government in funding vaccines. And this has come alongside the Compensation Fund and RMA. Our funding is targeted towards workers who do not have medical aid. And the reason for that being that vaccination or vaccines are deemed to be a prescribed minimum benefit. So if a worker is covered by their medical aid will provide funding for their specific vaccination. Our total contribution across all three entities is to the tune of 1.35 billion rand, and we've estimated that that should cover around about 3 million plus workers who do not have medical aid. We note that while a number of South Africans, including myself for that matter, have responded eagerly to government's call for all adults to be vaccinated, there are those who do have genuine questions and concerns. And it is for that reason that we are hosting this webinar. I would like to extend a warm welcome and heartfelt gratitude to our three speakers for today. It being Women's Month, it is befitting that we do have an illustrious panel of women who will be imparting some extremely important knowledge and insight and contending with our questions that we have where vaccines are concerned. So I'd like to thank Dr. Azwit Agarani, Dr. Jenny Sepaya, and Safia Joseph, who have put their hands up and we have committed their time to come and shed some light and impart some important information. Norma will introduce them in more detail at a later stage. I think it's also fitting that I do thank the FEM colleagues who've been instrumental in setting up this webinar for today. So Norma, Sanjay, and Gijs, thank you to the three of you for the work that you've been doing behind the scene and indeed the work that will continue during today's webinar. To everybody who has joined us for this webinar, I'd like to invite you to please sit back and enjoy the session and do ask all the pertinent questions that you have. I think no question is too small or too big or too silly for that matter. Information is power, and we all need to feel empowered in terms of making the decision around getting vaccinated. So without further ado, and in the interest of time, I will hand back to Norma. Thank you, Norma.
Thank you, Ndibuo. All right, so our first speaker today is Dr. Azwit Agarani. Dr. Azwit Agarani will be talking about COVID-19 vaccine workplace education programs and addressing vaccine efficacy and hesitation. So Dr. Azwit Agarani is a medical doctor and fellow at the College of Public Health Medicine of South Africa. She has a Master's of Medicine in Community Health. She dedicated over a decade to health systems, strengthening with an emphasis on building capacity for managerial skills in data-driven decision-making to improve quality of care and safeguarding patient safety. She has an interest in occupational health and is currently doing a postgraduate diploma in occupational health in the University of Witwatersrand. Azwit currently works as a medical doctor or medical monitor and safety physician with the HIV/AIDS Vaccine Trials Network and COVID-19 Prevention Network, which operates in Sub-Saharan Africa. The HVTN conducts all phases of clinical trials, from evaluating experimental vaccines for safety and immunogenicity to testing vaccine efficacy. NIAID formed the COVVPN, whose mission is to conduct phase 3 efficacy trials for COVID-19 vaccines and monoclonal antibodies. In this role, she has been involved in clinical trials from protocol to clinical research site development and ongoing safety monitoring of trials right through Sub-Saharan Africa and East Africa. She's currently part of the safety team on the Sisonke trial, which provided early access to COVID-19 vaccines to healthcare workers in South Africa. Dr. Agarani, a warm welcome to you and thank you so much for today's session. I'm handing over to you. Thank you.
Thank you so much, Norma Wetu. I am going to get right into it. So I think I've been introduced, no need for me to introduce myself a little bit further. I just did want to say that I'm going to really be pitching my talk at giving an overview of COVID-19 vaccines, because the one thing that leads to misinformation is when we do not have the correct information. And the only way that we can encourage our employees and colleagues to uptake the vaccine is if we have adequate information to give them and to allay or reassure some of their fears when they ask us questions. So as Norma Wetu has said, and in the introduction, I do work as a safety physician and medical monitor on ongoing COVID-19 and HIV vaccine trials. And some of these trials are actually sponsored by industry. So I do not draw my salary from industry or pharmaceutical companies directly. However, they are partners in some of the studies that we do. So just to declare that conflict. So I'm going to quickly skip through the outline in the interest of maybe just saving some time, and just start with what do we want a SARS-CoV-2 vaccine to actually do? And the main aim of a COVID vaccine is that we want it to have benefit at two levels. Benefit at the individual level is that the person who has been vaccinated, it will reduce the severity of illness in that person, or it may even reduce the chances of transmission of infection to that particular person. And while this is a very great individual benefit, I think what we are more looking towards is a community-wide benefit. We're looking at more the idea of reducing transmission or circulation of the virus within the community so that we can have healthier communities and we can actually have less stress on the health system. So as you know, when we have a surge of infections, some of the poor prognoses and outcomes, even deaths that we end up having, really are also a factor, an important factor that plays on that is access to healthcare when there is no longer a hospital bed for you to get treatment in time, to be started on oxygen. That could then lead to you having a poor outcome. Meanwhile, that could have been averted. So these are the two prongs that we really want a COVID vaccine to work at. And I think a lot of you have had a talk about herd immunity, just how many people would you need to vaccinate to reach herd immunity with COVID. And I must say with COVID, because of variants of concern, it keeps being a shifting target. But more importantly, the more people we protect in our families, the more people we protect in our communities, the more we protect our families, and the less chances of transmission we have to each person. So in order to understand the COVID vaccine and how it works, I think I'll just start off by showing you this diagram that shows actually the SARS-CoV-2 virus, that actually shows the SARS-CoV-2 virus up here. It's a spherical virus and it has these spikes, which are called the spike protein or the S protein. And most of the vaccines are actually targeted towards the spike protein. And so that's why it's important to actually understand this component. The spike protein is the component of the virus that goes on to attach to the transmembrane ACE2 and then a protein, and then that allows for it to enter into the cell. So basically all COVID vaccines are trying to do the same thing. So they're trying to mimic your immunity. So the first time you're infected by a virus, you develop antibodies against that virus, so that the next time you come into contact with that same virus, you already have the antibodies prepared to fight against that particular virus. So all COVID vaccines are trying to mimic that by introducing or getting your body to produce something similar to a spike protein, so that you can have spike protein antibodies, which will then block off or make it impossible for the virus to attach to the transmembrane ACE2 and enter the cell, therefore preventing infection. Or you have sufficient antibodies and T cell immunity that has been geared up so that you do not get as severely ill as you may have had you not been previously vaccinated. So I'm not sure if this video will play here. I hope it does. If not, we can just sort of move on. But this was just a quick video just to show you basically the whole idea. Oh yes, there, it's working. So we have the receptors there, and in SARS-CoV-2, that will be the trans ACE2 member protein. And then when you have the antibodies, when you form the antibodies, they go off and block the receptor, and therefore the virus cannot attach and cannot enter the cell. So in terms of vaccine design, we know that different pharmaceutical companies or organizations have taken different approaches to try and do what you just saw in the previous slide. And so I'm just going to quickly go through a few of the vaccines that are two of the strategies that we have available to us in South Africa at the moment. We have the mRNA vaccines in the form of the Pfizer vaccine. And basically, what the mRNA vaccines strive to do is that the vaccine introduces a message that tells your body, that stimulates your body to then produce antibodies to the spike protein through the mRNA encoded message. And then you have obviously an increase in antibodies, and eventually you also develop T-cell immunity. And that is how this portion of the vaccines works, the mRNA vaccines. Then we also have the viral vector vaccines, of which we have the Janssen vaccine that is available to us, which is the Ad26-S2 vaccine. And essentially for this vaccine, what Janssen is using is an adeno-26 viral vector. So that viral vector cannot replicate itself. And within the Ad26 viral vector, there is spike protein that has been introduced, synthetic spike protein that has been introduced. When the body recognizes the spike protein, it's going to form antibodies against it, and then it's going to be a similar mechanism to what you saw on the video to reduce transmission and also to stimulate your immunity so that if you get infected, you do not have severe infection. So here you can see in this illustration nicely, the spike protein is illustrated. There's also the enclosing nucleosid protein with the enclosing RNA and all the different layers of the SARS-CoV-2 antigen that the vaccines then try to mimic or to emulate. So if you think about this, the different vaccine approaches, then it could be really considered to be maybe as pieces of a sandwich, and different people using these different components to create a sandwich. But because it's different pieces of the sandwich, you can never actually end up so vaccines cannot infect you with SARS-CoV-2 because different components are being used to this sandwich. And even at that, the components or the pieces of the vaccine sandwich that are being used are synthetic. So they are not true virus components. And therefore you could never in a way end up being infected with SARS-CoV-2 from being vaccinated. So in terms of how we conduct vaccine research, and I think this is important to understand because a lot of questions stem from here. How did we actually manage to develop the COVID vaccine so quickly? And so this goes from when we develop vaccine research starts with just an idea. Someone thinks it may work to do it this way. There's a lot of lab work that happens. Then we go to animal testing. And then finally, we go into human trials. And in human trials, there are 4 different phases. Phase 1 being the smallest, where we take only a few participants, and we want to really evaluate if the vaccine is safe and determine a safe dosage and what are the common side effect profiles that we probably need to think about. Then we go to phase 2, where we continue to test effectiveness, but further evaluation of safety in a larger group of people. We then move on to phase 3 trials, where we really confirm the effectiveness, monitor side effects, and compare to other treatments that are available. And in our phase 3 trials, we have typically thousands to hundreds of thousands of people in our COVID vaccines. And then we go to post-marketing, which is phase 4, where we continue to collect safety information and look at the efficacy and look at the effectiveness, rather, at this point of the vaccine. So if you look at it, typically vaccine research goes in this linear pattern. However, due to the nature of the pandemic and the need to come up with a solution to the pandemic quickly, we did not do, research was not done in the stepwise manner. It was done in a layered or parallel approach. So ordinarily, there would be hesitancy to fund phase 2 when you don't know if phase 1 is actually going to be working. But if it's in a pandemic setting, then funding is available for phase 2 because this is an emergency and everyone wants to get to the answers. So what happened is that we layered the phases of the vaccine trials. The minute we saw that it was safe enough from phase 1, enough product for phase 2 was already developed and people had already been recruited and waiting on standby, and we moved right along to phase 2. And as soon as we got a signal that things were okay in phase 2, we managed to move on to phase 3. And this layering is really what played a big role in accelerating the development of COVID vaccines. So maybe just to give an example, up to 240 ideas of vaccinations actually were conceived, and a lot of funding went into them. And as you know, right now, we have about 5 or 6 vaccines on the market. So of those 240, only several proceeded to the next stage. So this is just to give you an idea that it's not as if the vaccines were really developed in a very short space of time. It's just that there was parallel development of the vaccines. And I think here, perhaps we've spoken a little bit about this, and I don't want to really labor on this one, the types of the different COVID vaccines that exist. And I've shown the 2 different examples of what we have actually in the country available at the moment. I'm also gonna skip this slide in the interest of time. And maybe just to say, when thinking about which vaccines are most suitable, it's important to think about how are the vaccines stored, how are they transported, and which shots do you, how many vaccinations do you need to receive, and the spacing of the vaccines. However, at this current moment globally, if there is any vaccine that has been approved that is available to you, so in South Africa at the moment, unless there's a contraindication to you getting Janssen or Pfizer, then you should get the vaccine that is most available to you at that particular moment. And I think the occupational health colleagues are going to dig considerations of developing a program and how you need to think about the needs of storage and transportation and other logistics that may come into it when you are now developing a workplace program. So I just wanted to touch on different vaccine myths, looking really at the myths versus the facts of COVID vaccines, and maybe trying to understand a little bit where some of the myths may actually originate from. And I think we've covered it in this one. Was the vaccine developed in a rush, and are they really experimental? And so the question really being, were COVID vaccines really developed in 1 year? And I would say absolutely not, because all the different technologies and platforms that you saw in the previous slides, people from all sectors and scientific fields came together and used their existing knowledge to be able to fast track the development of the COVID vaccine. And we certainly did not start from zero. And then we also had the parallel clinical development in terms of a relay race that was happening towards the development. There was ample funding for multiple vaccinations because obviously this was a pandemic and everybody was affected. Everybody in each country, in whatever sector, wanted to put funding so that our lives can actually start going back to normal. And there was also expedition by regulatory authorities. So last year, there was a point where SEPRA would say, if your work is COVID related, either it be COVID prevention vaccine, COVID treatment, they would actually push your protocol to the top and review it first. This did not mean that if they thought the protocol was not to standard, they would approve it. It just meant that it would take priority, and they probably increase the teams of people who were looking into these protocols and trying to expedite expedite authorization or approval for the research to take place. And then there's another important question that can mRNA vaccines actually change your DNA? And if you look in this picture here, you can see that mRNA actually does not even enter the nucleus of your cell. It actually has, it actually stays on inside, it goes into the cell, and then it relays a message for spike protein antibodies to be produced. But it does not enter the DNA, and it does not enter the nucleus of the cell, and therefore cannot change the DNA of a person. And there's also a question about, do vaccines actually make you feel just as bad as COVID-19 infection? And if that's the case, why would I be vaccinated? Then I may as well get COVID because they cause you to be equally ill. And that is not correct. COVID vaccines do not make you feel as bad as COVID-19 infection. Yes, there are very extremely rare, serious side effects, but the majority of side effects that are seen are reactogenicity events that are self-limiting within the first 3 to 5 days post-vaccination, and you feel totally fine after that. And in addition to this, vaccination actually offers you more durable protection than natural infection. And it also gives you a broader cover. So now when we are talking about variants of concern, through vaccination, you are covered for more variants of concern in comparison to natural infection. And so on the left here, I just wanted to show the slide that basically show that billions and billions of these vaccinations have been administered worldwide. And therefore, it would be not correct to say that we don't know the side effect profile of these vaccines. We are continuing to learn as we go by the day, but by far, the repercussions of severe COVID infection are far much worse than actually being vaccinated, where you get mostly self-limiting symptoms. So then what are the reasons not to avoid COVID-19 vaccination? So some people say, I have a history of allergic reactions, severe reactions maybe to penicillin, so I don't think that I should be vaccinated. And here, just to say that as a history of severe allergic reactions that's unrelated to vaccines or injectable medications should not deter you from actually getting vaccinated. You are more than welcome to consult with your healthcare provider, and maybe you can be, and what will happen in people who fall into this category, you will be observed for a longer period post-vaccination, just to make sure that you do not get an allergic reaction post that. However, this should not be a reason not to be vaccinated. If you have had severe allergic reactions to a vaccine or injectable medications, that's when it would be important to liaise carefully with your doctor, find out what your allergy history actually is, and to be vaccinated in a controlled setting. And then the other question is, I have underlying medical conditions. Should I not be vaccinated? And these are the people who we actually recommend for them to be vaccinated, because the risk of severe COVID-19 disease is actually heightened. So this is the group of people that we actually want to pull them in and to have them vaccinated. And if you have a history of vasovagal reactions, this is definitely not a contraindication to vaccination. And again, you can be observed for a bit of a longer period, and also take precautions just to make sure if you have another vasovagal attack, what can be done. And so then there's also, including on other comorbidities, there's a consideration of immunocompromised people and those who have autoimmune diseases. Again, these people should vaccinate. They are at risk of higher disease. And there's a lot of research that is happening around if people who are immunocompromised should actually get a booster dose. However, the research is not conclusive, although in other parts of the country, this process has already been initiated. What about people who have Bell's palsy, Guillain-Barré syndrome? These people may also receive the vaccination. They can consult with their healthcare provider, and the most appropriate vaccine to suit them can be chosen. Should people who've had COVID infection previously be vaccinated? Certainly, we've already explored the differences between vaccine-induced immunity and natural immunity, and explained that vaccine-induced immunity is more durable, but also has broader cover. And what about pregnancy? What about pregnant women? And lots, as I've shown in previous slides, billions of these vaccinations have actually been administered before. And as such, a lot of pregnant women have been vaccinated.
Apologies, Doctor, you seem to have muted.
Oh, sorry, I'm not sure what happened there, Sanjay. Sorry, so did I go on mute when I was talking about pregnancies?
Correct.
Okay, so billions of these vaccines have been administered, and lots of pregnant people have been in these cohorts. And following them up, there hasn't been a safety signal to indicate that there's any concern for both the mother or the fetus post-vaccination. And in fact, pregnancy does increase your chance of severe COVID infection somewhat. So these groups of people need to be included in the vaccination cohorts. Are there any reasons why we can delay vaccination? And this is delay does not mean not vaccinate. Yes, if you're currently not feeling your best, obviously, as we described, there are those typical reactogenicity symptoms that you may experience, which may include fever, malaise, pain in the arm, myalgia. And if you're currently not feeling well and feverish, this may obviously just make you feel a whole lot worse. The double effect may make you feel a whole lot worse. So therefore, there would be reason to delay your vaccination until you feel a little bit better. If you are recovering from multi-system inflammatory disease, there's evidence maybe to wait up to 90 days. And the same goes for if, as part of your SARS-CoV-2 infection, you were treated with monoclonal antibodies, then maybe wait about 90 days prior to actually receiving the vaccination. So just as some closing of thoughts, and then I'll take a few questions. I think that with the billions of doses of COVID vaccines that have been administered, there is reassuring and consistent evidence that the vaccines have a good safety profile. There has not been anything that is indicating that we should stop the vaccination programs. So we are good to go from a safety perspective. When you come across information that you read online, it's always good to verify that information with your healthcare provider, because there's a lot of misinformation out there. And we need to get vaccinated so we can go back to our normal way of life. Because life has changed so drastically. Some changes have been beneficial. However, some of it has not been sustainable, bringing economies and livelihoods to their knees. And most importantly, once you have made that choice to be vaccinated, please remember to keep on with the non-pharmaceutical interventions, observing physical distancing, sanitizing, wear your mask, because that is the only way that we can actually get to beating this pandemic. I do want to give show the slide of acknowledgements. I have said that I work for the COVID-19 Prevention Network, and some of the slides that I used in this presentation have come from the work that we do collectively. And for specific ones, then I did show the slide credits on each slide. I want to open up for questions. Sanjay, I'm not sure if there have been questions in the chat or how we'll be fielding questions, or if there's still time for questions. I'll hear from you.
Thank you, Dr. Azwi. Thank you so much. There certainly are a few questions that have come through the chat. And if it's okay with you, I'll take 2-3 questions. We've got about 5 minutes for Q&A. So I'm not sure if you want me to ask one question at a time or you answer, or I bulk them into 3 and then you address them like that.
I think I'll take 3 at a time. Yes, that's better. More time.
Perfect. Some of the questions have already been addressed in the presentation, so I'll just briefly go through them and then we'll take it from there. So Ernst has asked is there more information on the Johnson & Johnson vaccine as well, because some hospital workers received the Johnson & Johnson vaccine. And then the next question is, what happens if the employee is allergic to a vaccine, for an example, like smallpox, and have exemption from it? Smallpox vaccine have some of the same ingredients as some of the current COVID vaccines. Do they risk going for the COVID vaccine? That's a question from Kathleen. And then a comment from Michelle. A lot of hesitancy about or around the vaccine is not necessarily around the efficacy or the safety, but rather about the mistrust in the government to provide us with safe vaccines. This on the back of numerous mainstream news articles of expired vaccines being received. Okay, and so people are fearful of receiving an expired vaccine with association around severe side effects or no efficacy at all. Or people are also concerned about around receiving fake vaccination and therefore developing severe side effects. So there's the three then that you can address for now. Thank you.
Thank you, Nomawetu. Just to say, yes, there's been, with the first question, J&J vaccine effectiveness in the healthcare worker cohort. So the Sisonke trial, of which I did participate as a safety physician on the trial, about 2 weeks ago, we did publish the effectiveness, the interim analysis of the effectiveness data, basically showing that the vaccine still does prevent severe infection. And so what has happened is that after the initial trials with efficacy, we tried to match to see if there was a similar profile in terms of effectiveness. And if you go into the Sisonke website, you'll be able to see those results, showing that, yes, there have been people who've gotten severe diseases, severe disease. However, when you compare it to the non-vaccinated healthcare worker cohorts, we have actually been able to show that a lot of severe disease has been prevented, a lot of severe disease and death has been prevented in our healthcare workers by actually affording them the opportunity to be vaccinated by the J&J vaccine. So empiric evidence coming out there, and publications also on the way for you to touch, paper and say this is actually what the numbers are actually telling us. And in terms of allergy, yes, you're correct, Norma. I think we did touch on this a little bit. If you've had a severe allergic reaction, so anaphylaxis or some severe allergic reaction to that accord, then to a vaccine or injectables, then it is very important that you consult your healthcare worker, your healthcare provider. Your healthcare provider is going to guide you, in determining what was the allergen that you reacted to. So different vaccines have different components. And in the COVID vaccines, the most allergenic component is really the PEG or polysorbates. So your healthcare worker or your healthcare provider is going to assist you in determining that. And once you've determined that, they're going to choose the vaccine that is most appropriate for you, depending on if you are allergic to PEG or polysorbate. So what it will come down to is vaccination with a better candidate. Being vaccinated, perhaps you would not be the sort of candidate who should be vaccinated at an occupational health clinic at a workplace, but to go into your doctor's room and be vaccinated in a more controlled setting after allergy history and investigation has been done properly. And in terms of expired vaccinations, I think the reports that came out really were actually a show that the rigorous mechanisms of vetting vaccinations are actually working. And I think the person who posed the question may be referring to the J&J vaccines that had to be discarded. And it was actually an issue that was picked up during quality monitoring. And it was not that they had expired, but during quality monitoring, some of the standards were not met. and those vaccinations had to be discarded. And I think this just goes to show that there is a particular interest in ensuring that not only do we give vaccines to the population in time, but that no corners are cut. And even if it means that there are millions of doses that may have to be discarded, that will be the route that is being taken as opposed to taking any chances. So in terms of that, I think it's really a good message coming out of that story. And in terms of fake vaccinations, I think my recommendation is, I mean, I haven't heard really of people getting a fake vaccine. There are different vaccinations which have different levels of efficacy or effectiveness and the safety profile. But more importantly, like any other investigational, like any other medicinal products that you take, you know, maybe if you want to be vaccinated, go to a healthcare provider that you trust, go to your workplace. And if needs be, ask for the documentation to say, hey, you know, can you show me if the packaging, is it SAPRA approved? Is it FDA approved? And that sort of thing. However, I must say I'm not totally aware of people maybe using fake vaccines that have not been developed and authorized accordingly. Thanks, Noma Wetu.
Thank you so much, Dr. Azutakalani. I just want to acknowledge that we are noting all the questions that are coming through. Unfortunately, because of time, we're not able to go through more, specifically with Dr. Azwi. So we will note them and we'll make sure that they are all addressed. Once again, this session is being recorded and some of the things are being addressed in the presentations themselves. But we will go through the questions again and we'll make sure that all the questions are addressed. Thank you so much. And please keep them coming through. Dr. Azwi, I think I speak on behalf of everyone that it's been a very informative session. I personally enjoyed the analogies that you used to clarify some of the medical and technical terms. I think also a great job on demystifying the myths around vaccination and the importance of delaying when there is a plausible excuse rather than deciding not to go and get vaccinated at all. Thank you so much for your time. So right now, I am going to introduce our two next speakers. It is a joint session, but it will first be conducted by Dr. Jenny Sapaya. And then it will be followed by Sophie Joseph. So the session is, they will introduce the specific topics around the sessions, but I just wanted to introduce them before I hand over. So Dr. Jenny Sapaya is an occupational medical practitioner who has been in the field of occupational health for the past 25 years. She completed her undergraduate in medical degree and postgraduate training in occupational health at Wits. She currently is employed at Life Employee Health Solutions, where she's been working for the past 21 years, working initially in the occupational health clinics and currently in the role as clinical standards manager. She has a wide range of experience in the mining, metal industry, and transport sectors. In her current position, she's responsible for quality assurance and compliance and also provides a supportive and advisory role to key clients on occupational health and related matters. She's a member of the SS Society of Occupational Medicine, SS Society of Travel Medicine, and Mine Medical Professional Association. I'll introduce Sophie Joseph together with Dr. Jenny, as it is a combined or joint session. So Sophie Joseph is a counseling psychologist who has an extensive experience in the field of employee well-being services and trauma, and has been in clinical practice for almost 20 years. She was the area head of psychological services at the South African Police Services for 5 years, and thereafter consulted in private practice, dealing with a range of psychosocial issues across different industries, both in the public and the private sectors. She's currently working as the wellness training lead and clinical consultant for Life Employee Health Solutions. Her core areas of responsibilities are providing innovative clinical solutions on an individual and group level to help employees achieve their potential personally and professionally. Using training as a medium that seeks to educate and proactively deliver health information, she encourages employees to take ownership of their emotional well-being. She believes that a happy, healthy employee is a productive employee, thereby ensuring a win-win for both the employer and the employee. Thank you so much, ladies. I will hand over to Dr. Jenny to start the session. I'll hand over to you. Thank you.
Thank you, Nomawethu. I'll start my video so you can see what I look like. I'm Dr. Jenny Sapai, as Nomawethu introduced me. I'm going to be talking on the medical impact of long COVID. So I'm going to start sharing. Are you seeing my screen?
We are, if you can just go full screen.
Okay.
Perfect.
Right, perfect. Okay, thanks very much. So following on from the previous talk on vaccinations, I'm going to be talking on long COVID and the medical impact. And I'm hoping that this will give you some insight into long COVID and what it entails, and will hopefully encourage you as well to take the vaccination to prevent something like long COVID. To move this across, sorry. Right, so when the COVID-19 epidemic began, initial descriptions of the symptoms focused mainly on the clinical presentations of the patients in the acute inpatient setting. There was a lot of emphasis was placed on people who had died or people who had recovered from SARS-CoV-2 infection, but less recognition given to those with persistent symptoms. And the term recovered can be a misnomer and confuses public and clinicians. Even the data that we have that is given to us on a daily basis, if we go onto the SA Corona website, coronavirus website, it gives a number of tests done, it gives the number of people recovered, gives a number of deaths, but there's no indication about people who have recovered from COVID but are still living with prolonged symptoms. Right, so what are these prolonged symptoms? People who contract COVID-19, most of them recover within 2 to 3 weeks. However, some of the people, even those who've had mild COVID-19 illnesses, experience symptoms for months after their initial infection. So these are known as, in layman's terms, as long COVID or COVID long haulers. And this generally describes people with COVID-19 who experience symptoms for more than 28 days after diagnosis. Long COVID is new. Obviously, COVID itself is new. And we don't fully understand what this means. And currently, people are still trying to report in symptoms into repositories so that people can analyze and collate the information and come to a better understanding of what long COVID means. Long COVID is a topical issue. The experiences of COVID survivors make this a topical issue. COVID being a relatively new disease, not enough information is available, as I said, and we're learning about it as we go along. A lot more research is needed. As time goes on, we're collecting data, and as we're collating it and analyzing it. So here we have lots of, you see lots of information on long COVID in the media. So to get onto the terminology, recently it was initially named long COVID, but recently the National Institute for Health and Care Excellence, otherwise known as NICE in the United Kingdom, has now given names to the terminology. We know about acute COVID-19, which is really the signs and symptoms of acute COVID-19 up to 4 weeks. Then you get ongoing symptomatic COVID-19, and these are signs and symptoms of COVID-19 from 4 weeks to 12 weeks after the onset of acute symptoms. And it's estimated that 1 in 5 people have ongoing symptomatic COVID-19. And then you get what's called a post-COVID-19 syndrome. And this is signs and symptoms that develop during or after an infection consistent with COVID-19, but continue for more than 12 weeks and are not explained by an alternative diagnosis. And you can see that the number of people in this group is thought to be 1 in 10. So actually quite high, given the number of people in the world who have been diagnosed with COVID. And it usually presents with a cluster of symptoms, often overlapping, which can fluctuate and change over time and can affect any part in the system, any part of the body systems. And I think it's this fluctuation of symptoms that is so frustrating to the person who is suffering from long COVID, because they cannot feel that they're ever recovering, and they never know from day to day whether their symptoms, whether they'll have a good day or a bad day. There's other terminology, what we refer to as long COVID. So this is not the clinical definitions, but this is commonly used to describe signs and symptoms that continue after acute COVID. And they can be on both ongoing symptomatic COVID-19 or post-COVID. So it includes the previous two definitions. And then there's another terminology called PASC, or post-acute sequelae, sequelae meaning consequences or results of SARS-CoV-2 infection. And this is persistent signs and symptoms associated with COVID-19 beyond 4 weeks of acute illness, and is not better explained by any other disease process. This slide shows you really a timeline of COVID-19 disease in terms of infectiousness or infectivity and symptomatology. So how infectious you are and what are your symptoms. And we look at the top as acute COVID, and then we get the post-COVID time. The post-COVID also broken down into the subacute or ongoing, and then the chronic post-COVID-19. When we look at what is the timeline of COVID, we know that there's a pre-exposure period, then you get exposed, and from week 1 after exposure, you start to see symptoms. And this is also where you start being infectious. When you have the virus, the virus grows and replicates, and you get a high viral load. And as you cough and sneeze into the air or onto your hands, the virus will come out and go into the air and can infect people. After 2 weeks, you're usually no longer infectious, and also the symptoms usually will be passing away. When we're looking at the subacute or the post-acute COVID-19 period, this is the period after 4 weeks. And you can see it actually affects most of the body systems, the lungs, the brain, the heart, the vascular system, the kidneys, and the skin. And there's also, we also see that it affects people generally in terms of fatigue and decline in a quality of life, with muscle and joint weakness and pain. Right, so who's at risk of long COVID? So somewhere between 2.5 and 15% of people are still symptomatic after 12 weeks. And this makes it quite a complex and challenging, as it doesn't only affect people who have been ill, but it affects anybody who's actually been exposed to COVID. The factors that appear to be associated with a greater risk of suffering from long COVID appear to be having pre-existing health conditions like asthma, hypertension, and diabetes. Apologies for the misspelling there. People of increasing age, people who are overweight, have a high body mass index. The female gender are also thought to be more prone to long COVID, although in some of the studies there is conflicting data. And it's thought that possibly women have a better health-seeking behavior, and they will attend physicians and doctors more than men will. And consequently, it possibly looks like there is a higher incidence in women. Healthcare workers also seem to be at risk of long COVID. And the reason for this is it's thought to be related to the higher viral load that healthcare workers are exposed to, especially ones who are working in COVID wards, in ICU, or where they are exposed for long periods of time to high levels of the virus. And then also people who have multiple symptoms at presentation. So that's the presentation of the initial COVID illness. Those people who have more than 5 symptoms of COVID, and we know that there are about 10 or 12 symptoms of COVID. So people who have got multiple symptoms at presentation also seem to be more likely to be at risk of getting long COVID. So what is the pathophysiology? This means the disordered physical processes that are associated with the disease. So we see that there's a virus-specific process that happens. These changes are virus-specific. And we know that COVID is associated with an over-exaggerated immune response, what I'm sure you've heard of the concept of a cytokine storm, where the body starts to attack its own cells rather than just fighting the virus off. So it's thought to be a result of the inflammatory and injury that occurs during the acute infectious period. Injuries can occur in a variety of organ systems, including the brain, the heart, and obviously the lungs. And ultimately, the injury may be widespread throughout all organ systems in the body. There's no ongoing SARS-CoV-2 infection, as I said, so it's non-communicable, it's not infectious. So people who are suffering from these long-term effects of COVID, they're not infectious. And then you get something what's known as post-intensive care syndrome, where people who have been in hospital and have been admitted to intensive care, it can be quite a traumatic process, both mentally and on the body. And this is now a well-recognized syndrome and includes new or worsening abnormalities in physical, cognitive, and psychiatric domains after critical illness. Right, so what are the symptoms of long COVID? So the symptoms are highly variable and they're wide-ranging, and their most commonly reported symptoms include, but are not limited to, the following: to fatigue, which can be general or post-exertional, so after exercise. And you'll see that athletes or people who have been physically fit and can run marathons and do really hard, strenuous training find that they can hardly even get up and walk to the bathroom. Then you get the respiratory symptoms, the persistent shortness of breath and the persistent cough, sometimes chest pain. Also in the musculoskeletal system, you get joint pain and muscle fatigue. And then the less common symptoms are the neurological, the headaches, the neurocognitive disorder, this kind of what's known as brain fog, which we'll talk a bit about later, but it really is a sensation that you cannot concentrate, you cannot find words, you cannot think as straight as you previously did. And this obviously has a huge impact on the working environment. And then there's muscle pain, fever, obviously the severe fatigue. And all of this really increases the risk of people being depressed and anxious. And heart palpitations are another thing. So these symptoms can either be, they can be multiple, you can have more than one of them, they can be varied, and they do fluctuate over time. And as I said before, what's very frustrating is the fluctuation, where people think, oh wow, I'm actually over this, I can carry on with normal life, I can get back to my work, my family, my social life, my sports. And then they find 3 days later, they're back where they started. So as I said, this also results in a lot of anxiety and depression. And this is associated with a protracted and unpredictable course of the symptoms. Right, so just to look at some of the organs, we know that the coronavirus, the group, and certainly the SARS-CoV-2 is certainly responsible for COVID pneumonia and for affecting the respiratory system. We know that people need oxygen and end up in ICU, who have to be ventilated due to problems with the pulmonary system. So some people end up with, following pulmonary pneumonia or COVID pneumonia, they end up with a persistent interstitial lung disease. So this is a CT scan of a lung, and this is a healthy lung. the black part is air, and you can see this is a very well aerated lung. I'm not actually, I'm not, oopsie, sorry. I'm not showing it to you, but the image on the left is a a healthy lung, well aerated, but lots of air, and that is represented by the black. On the right-hand side, you can see that where the arrows are pointing, there is what we call fibrosis, or damage of scarring of the lungs. And in these spaces where the lung is damaged, there's no breathing can take place. And this is responsible for the shortness of breath, the dizziness, the tiredness, the fatigue. Excuse me. Sometimes people get persistent symptoms with normal pulmonary function tests. So they go to their doctor, so they're really struggling to breathe. Sorry, I'm just going to have a sip of water. Always happens at the lung part. They get persistent symptoms with normal pulmonary function. The doctors will do all the lung function testing, the x-rays, the imaging, and say there's nothing wrong, but they have persistent symptoms. And other things you get with pulmonary disease are pulmonary emboli, which I'll talk to now, and hemidiaphragm paralysis. So the half of the diaphragm becomes paralyzed. So we know that clot formation is quite a serious complication of COVID itself. It can occur in the stages post the 4 weeks of COVID. And you can get blood clotting in the limb, normally in the calf muscle. And this can cause pain and swelling and redness of the calf muscle. Sometimes this clot can actually dislodge and can travel and end up in the lung, causing a pulmonary embolus, which and the symptoms of the pulmonary embolus include shortness of breath, chest pain, and cough. And sometimes the cough produces phlegm that can be flecked with blood. People can experience lightheadedness and palpitations, and a major pulmonary embolus can actually be fatal. For this, you do need to see a doctor for the diagnosis, and they will do some blood tests to see whether you are at high risk of clotting. They can do CT scans or VQ scans to diagnose the clot. And the treatment of thromboembolism is anticoagulation or blood thinners. And this would need to be taken for possibly for 3 months, possibly for longer, possibly for life. Then on the neurological symptoms, I did refer to this earlier on, but here we have issues with short-term memory, concentration and word finding, speech difficulties, this brain fog. And there's no clear correlation with the severity of the COVID infection or how old people are or if they have comorbidities. So really, it seems like anybody can actually present with this brain fog. The symptoms often fluctuate. You have good and bad days, and the fluctuations often correlate with other symptoms like fatigue and dysautonomia. Dysautonomia refers to a group of medical conditions which are caused by problems with the autonomic nervous system. The autonomic nervous system is the part of your nervous system that controls your involuntary body functions, like your heartbeat or your breathing or your digestion. So it possibly can cause a rapid increase in the heart rate or a drop in your blood pressure, and this causes dizziness and causes fatigue. And this is really quite a common thing that's seen in long COVID. Also, it impacts on life, on your people are not able to work, and sometimes people have to go on disability, so it's variable. Also interferes with sleep patterns and sleep ability to sleep, and this also compounds the fatigue. Many patients experience depression and anxiety or post-traumatic stress disorder. People suffer from headaches, paresthesia or tingling in the extremities, your fingers and toes. But mostly people have multiple complaints. So we can see, because it affects the many organ systems, it really has to be managed in a interdisciplinary way. And the aim we'll need to work towards is having long COVID clinics all over the country. Currently in South Africa, there's one long COVID clinic in KZN. And there are various universities which are setting up kind of talk groups or trying to get people to submit information on long COVID so that they can analyze and try and manage this better. So you'll see you'll need to, if you have the continuous respiratory symptoms, you'll need to be attended to by a physician who specializes in lungs or cardiovascular. If you're having heart problems, for the blood clots, you might need to see a hematologist. For the neuropsychiatry, you might need to see a psychiatrist, a psychologist, ready to assist with all those psychological issues. And if the kidneys are impacted, we'll need to see a specialist in kidney disease. Obviously, at a primary healthcare level, there's a lot of attention that needs to go into rehabilitation and addressing the mental health issues. And physiotherapists have a very good role in increasing people's ability to increase their exercise tolerance, to try and get them to breathe better and to manage those physical symptoms of exhaustion. Sleep hygiene also important, to learn how to manage the sleep disorders and really, and really try and reduce that fatigue that's getting complicated by the sleep disorders. Right, so you can see this is quite a complicated disease that we're dealing with. We're still learning about it. I've addressed the medical side of it. I'm now going to hand over to Sophia, who will talk to the psychological impact of COVID, long COVID. Thank you.
Thanks so much, Jenny. I'm going to thank you, everybody, for the opportunity. I'm going to talk about the emotional impact of long COVID. If you can just let me know as soon as you see my screen.
Okay, nothing yet. Okay, there we go. Just go full screen.
I'm hoping you can see it now and that it's in the correct view.
It is, thank you.
Excellent. Thanks so much, everybody. I'm Safia. As Noma introduced me, I'm the Wellness Training Manager for Life Employee Health Solutions. I'm a psychologist by profession. I've been practicing for almost 20 years now, and now I've given my age away. So hopefully in talking about the emotional impact, I'm also able to draw on my experience of other conditions that we've also treated, and probably provide some strategies on how best to move forward from this. As with the medical consequences of COVID, a lot of the treatment is symptomatic. I think that when we look at the emotional impact, you'll see in large part many of those consequences, the mental and emotional consequences, also are treated symptomatically as well. But just by way of introduction, just for everybody to basically get a sense of where we're at and where we've come from. I think when COVID landed on our shores, for many of us, up until March the 5th last year, it was very much an issue that was in China and in USA, and we didn't quite anticipate the impact that it was going to have on our lives over the past 18 months. So initially when we went on the hard lockdown, and you'll see that these waves that I refer to are not necessarily aligned to the virus progression and the first, second, and third wave that we're hearing about in the media, but is more around what have been the priorities that we've been dealing with since the start of this pandemic. So in the first wave, very much we were looking at the mortality and the morbidity. We spoke about the higher risk groups being the older population with comorbidities, which we saw very clearly in the first wave, in the first variant that was on our shores. That has since progressed, where we've realized that whilst that is an indicator and they might be at higher risk, that nobody is immune from this disease. It moved on to the second wave being our concerns and needing to prioritize our healthcare system. in terms of our resource management, what we had available, not just from our healthcare facilities, being able to cope with the increased number of people being hospitalized, but also in terms of our access to tests, access to gloves, and a whole host of other things, not the least of which has been the vaccines. We saw this and we became glaringly aware of our shortfalls towards the latter end of the first wave when we realized just how ill-equipped we were to deal with this. And because of the demand for gloves, hypodermics, bed space, oxygen, all of those things, that we needed to step up our game in South Africa. At the third wave, what we were dealing with were people that had chronic conditions, not just physical chronic conditions like diabetes, hypertension, cholesterol, who were not taking their meds during that time, but also psychological chronic conditions, depression, anxiety, people that should have been on medication for schizophrenia, bipolar disorder, not being able to access the care that they needed during the hard lockdown. And as a result, their priorities and their focus shifted to dealing with the physical conditions and less so the psychological ones, and not taking their chronic meds as they were. And you can imagine that this would lead to an even bigger crisis on our hands that will be with us for a longer term. The fourth wave that we've dealt with, and as you can tell, these waves are just easily becoming quite debilitating on our population, has been the psychological and psychic trauma that we've had to deal with. Mental illness, not just for people with pre-existing conditions like depression and anxiety and schizophrenia, but also the advent of people having to work remotely just amplified people's sense of loneliness. It increased the depression and anxiety that people were feeling. People having been diagnosed with COVID and now being afraid to go out in public, afraid to go out and buy bread and milk or your routine kind of tasks that we usually took so much for granted. And also with people working from home and unable to be able to deal with a proper work-life balance and imposing the boundaries that they need to, feeling very burnt out and really struggling to be able to cope on a day-to-day basis. So where we're at right now, and this is not just we move from the first to the second to the third to the fourth to the fifth and then we're done. These are concurrent challenges that we're dealing with. The fifth wave is, what do we do with long COVID? It has been quite a topical issue, as Jenny has said. It's something that has come up and we're still doing a lot of research around it, both from a medical and a psychological point of view. But we're seeing that people that have had COVID, whether severe illness or mild illnesses, are struggling with symptomatology long beyond their infectious period. So the post-acute care, the long-term care that we're needing to provide for people is creating an added strain for us, both from a workplace point of view and also from a personal and healthcare point of view. Because as you can imagine, the more time that goes on and the longer this reality persists, that we're in this middle of the pandemic, that we're not breaking the back of, the greater the impact it's going to be on someone's mental well-being. There'll be fear, there's going to be low mood that sets in, feelings of anxiety, depression, that are also exacerbated by feelings of physical exhaustion. So the way we have traversed, I think, this pandemic lends itself to many mental health issues. And whilst there isn't much data yet, not sufficient data on the psychological impact of COVID, we can definitely see and have been seeing for a long time that there's an undeniable relationship between our immune system and the neurological changes and subsequent psychological symptoms that we are seeing. So where recovery from COVID is taking weeks or even months, the mental, physical, emotional symptoms that are lingering for much longer are equivalent to any kind of long-term debilitating disease that we often have to find a way to cope with. So when we're not recovering in the expected time frame, when we're hearing our doctors say that after 14 days, we can pretty much return to work, not needing a negative COVID test, and that we're no longer infectious, the expectation is also that, like with the normal flu, that once you're no longer infectious and once you've dealt with the primary symptoms, that you're going to be better. And when that doesn't happen, it leads to a lot of frustration, a lot of confusion, and a lot of fear, right? So some of the symptoms that we're seeing, depression, anxiety, Jenny spoke about COVID fog, and we'll talk a little bit more in detail around that. But we're seeing other post-traumatic stress symptoms as well. The fear, the intrusive thoughts, people are worried about the lingering effect of this and whether they're ever going to be able to cope again. The disturbances with memory, disturbances with concentration and focus, all of those are just compounding what is already a very confusing and very debilitating time for most people that are struggling with long COVID. So we're seeing from a PTSD point of view, people struggling with flashbacks, nightmares, replaying the event over and over in our mind. People have become hyper-vigilant, so constantly symptom checking. I know of a number of people that have easily been for about 20 COVID tests every time they have a cough or a sneeze or have come into contact with somebody else that was coughing or sneezing. They've become so worried and so freaked out that they might have been reinfected, that they might be struggling and will go back down the same route that they have before, that they're checking and constantly rechecking their symptoms, checking their oxats levels and going for repeat COVID tests. What it's resulting in is also very poor quality of life. Jenny spoke about the impact on the workplace. You can imagine for people that have returned to the workplace after their COVID infection, knowing that they're now safe, who are still struggling with memory issues, concentration issues, fatigue, where it's difficult for them to be able to even complete a full day at work without feeling like they're just going to pass out, that this is going to just amplify a depressed mood. It's going to amplify the anxiety. It's going to amplify when are we ever going to move beyond this. So what do we do? What do we do for people that are struggling with long COVID? What do we do for ourselves when we're experiencing these kind of symptoms? How do we help family members and loved ones who are also frustrated because they don't know what more to do for us when we continuously indicate that we're not over COVID? We all have a role to play in coping with this. First step for me, and I think this is as true for a COVID infection as it is for a long COVID one, it's that it's really important that we do not stigmatize. Many COVID-19 survivors describe being stigmatized and feeling like people are afraid of them, worrying that they're still contagious. Because when they have these symptoms on an ongoing level, people are worried that they're not quite safe yet, because if you were better, why are you still symptomatic? I think for many people also that I've seen, clients that I've seen that have struggled with testing COVID positive, especially when they've been careful, have abided by all of the regulations, have practiced all the NPIs, they really tend to go on a, I'm going to call it a witch hunt, trying to find out where it was that they got the virus from, who was the culprit that made them ill. And it's really important that, that we don't spend all of our energy worrying about who is to blame for this, who is the culprit for this, because it takes away the energy that might better be channeled elsewhere, but it also amplifies our sense of anxiety, wondering whether each person that we've come into contact with is the culprit. It's really important that we're patient with others and with ourselves as well. We acknowledge that it might take months to completely recover from this, so we're kind to ourselves and kind to our loved ones if it's taking them longer than the recognized period, that we verbalize to them that we're there for them if it's someone else that you're worried about, or that you verbalize what your needs are so that people know how to assist, and that we make sure that we don't overlook physical symptoms. We don't overlook it when people say to us, I'm feeling worse today than I did yesterday. Jenny spoke about the fact, and you'll see that it's a recurring theme, that some days are better than others. And just because some days are good days, and we see this with the COVID infection as much as it is with long COVID, just because some days are good days doesn't mean that you're out of the woods yet, because you could also have bad days. To help our loved ones keep track of their physical healing as well. This is also great for their mindset and for the sense of achievement that they'll get, that they're doing little bits and pieces that are moving them on the road to recovery. A good support team really does help, and this is both important from a medical point of view as much as it is from a psychological point of view, that we encourage people to keep us updated on their progress, how you're feeling today, but also on their challenges as well. Because you might think that this is a psychologist talking, but talking really does help. Just verbalizing and expressing to somebody, ventilating with somebody on your bad days and also on your good days, expressing your fears really does give us some relief and helps us to concretize what is in our heads. We need to encourage others and ourselves to be kind to ourselves, because when we find that we're not getting better as soon as we would like to get better, we need to remind people that it'll take time for them to get back to who they were before COVID. Avoid saying things like snap out of it or just think positively. What we want to do is acknowledge that it might be difficult for them, that it's okay to not be okay, and that nobody is doing it on their own. And it goes back to the point I was making about a good support team. There are some support groups that are available at Life EHS. I can tell you that for the client companies where we have set up these kind of support groups, we've had really great success reported from attendees, where it gives them a platform to be able to talk about their concerns and their worries. Even how they're struggling with the length of time that it's taking them to recover from this.
Sophia, we seem to have lost you there for a second. Seem to have lost Sophia. Just give us a moment.
Hi, can you still hear me?
Okay, sounds like you're back. Your presentation has also disappeared, so you'll have to reshare.
I will do so now. Let me know when you can see it.
Okay, it's busy starting up. Okay, we can see.
Thank you, everybody, and apologies for that. I'm not sure where I lost you, but just to repeat the last point that I was making, that it's really important that for organizations that don't have an EWP service provider, that you do reach out to other mental health professionals. There are organizations such as the South African Depression and Anxiety Group who do have scores of resources, articles, support groups that will be able to assist as well. Because really early intervention is key. The sooner you reach out for help psychologically when you're not coping, the better you are likely to have that support during your recovery period. So some practical tips for managing long COVID, right? We've spoken about fatigue and breathlessness. It's really important that you pace yourself, that you plan what you're going to do, and that you don't overexert yourself. It's important to break up activities or tasks into smaller chunks, and then alternate easier and more difficult activities. The sense of achievement that you'll get when you triumph over something really will motivate you to continue. But that it's also important that you consider what the best time of day is to do certain activities based on what your energy levels might be. For some people, when they wake up in the morning, they're really fatigued and it's really difficult for them to get going. So to do the lighter activities at that point until you feel like you've worked up the energy to tackle things that might be a little bit more onerous. Frequent short rests are really important. So you give yourself time to recharge and rejuvenate, and that you shouldn't stop doing things just because it might be a little bit difficult. Now, this is, of course, taking into account any advice from a health professional that you might get. So you don't push yourself, but at the same time that you don't inculcate almost this air of sedentary activities where you're sitting for most of the time. You stop using your muscles, because if you stop using your muscles, they'll get weaker, which makes you more breathless when you do try to use it. To start perhaps with a smaller activity level and then gradually increase the amount of exercise that you do. So going for short walks, doing simple strength exercises, and then building it from there. And for those that during COVID ended up with severe COVID and needed some sort of walking aid thereafter or assistance, even with our older population that might use a walking stick or a frame, that when you find yourself feeling breathless, if you're taking a short walk, that you lean forward on it as well, because that will alleviate some of the breathlessness. Tips for thinking and memory issues. We spoke about brain fog or COVID fog. It's important that you use whatever tools that you can use, things like little Post-its, making notes to remember things by. So having your to-do lists and ticking it off the list as you move through it. I find that that is also a function of age. So I don't know if long COVID is altogether to blame, but I find myself remembering fewer and fewer things these days without the benefit of a to-do list. So this works as well, whether you're struggling with long COVID or not. That it's important that you try and reduce distractions, because you find that if you're focused on something and you have distractions around you, already your concentration levels and your energy levels might not be at optimum levels. So when you have distractions around you, it takes that much more energy to focus, to have a clear plan before approaching any new problem. Especially if it's a complicated problem or a situation. I spoke about breaking it up into smaller chunks, certainly does help. And then keep checking your plan as you follow through on it to make sure that you're moving in the right direction and that you're moving. Relieving joint and muscle pain. Again, I'm going to say check with your doctor or your health professional before starting anything new and to see what your capacity is. Flexibility exercises, strength exercises, even if it's just gentle stretching, is really important to relieve joint and muscle pain. And then to boost your mood and to stay on top of your mental health. I've said already, but it cannot be said enough times. It's really important that you be kind to yourself during your recovery. You need to be aware and be prepared that some days will be worse than others. Not because of anything you're doing or not doing, but just because this is the trajectory of long COVID. So it's important that you don't force yourself when you're having a bad day. On those days, you might want to connect with other people. I think that one of the biggest misnomers that has come out of this pandemic has been this notion of social distancing. And whilst the thinking and the methodology behind it is accurate, what we actually want to encourage people to do is to physically distant. So we want people to remain 1.5 meters or 2 meters away from one another. That's physically distanced. But we want people to be socially connected. This, as I've said during the pandemic and also with remote working, has certainly created an additional challenge of having to navigate loneliness, especially if you live alone, or you don't have anybody in your immediate vicinity and your family are far away from you. It cannot be said enough times how important it is that we connect with other people, our loved ones, our colleagues, our line managers, each other. It's really important that we remain connected, because connecting with other people certainly does make us feel happier. It makes us realize that we don't live on an island. Having a daily routine can be good for your mood. It's good for your sense of stability as well. It gives you a sense of predictability, that you know what needs to happen from a day-to-day basis. What next? This is the time. This is what I'm meant to be doing. It's really important that we maintain a daily routine. And I'll talk more about that when we talk about sleep in a couple of slides. And then it's really important to stay active. I've spoken already about the dangers of being sedentary. Continuing to move, and it doesn't have to be hectic exercises, will also help to release endorphins, and that improves our mood as well. And then our stress levels. And I think we all can say, raise our hands when I say, is anybody stressed? Because everybody is dealing with some level of stress, and for some multiple stresses as well. This is not exclusive to this pandemic of COVID-19 or long COVID. I think we're going through very stressful times, and we're navigating multiple stresses. So whether you're dealing with the large-scale national emergency, if we're looking at this public health crisis that we find ourselves in, or just for yourself going through a rough time personally, a couple of things, a few step-by-step things that we can do to remind ourselves that the first thing is to step back. It's really important that we are aware of what's happening around us, but too much of a good thing and too much of a bad thing is really bad for you as well. So limit the amount of time that you spend in front of screens or reading about the events of the day. Whilst it's important for us to remain informed, we want to do this without increasing our anxiety levels. So it's really important that we take a step back from the flood of information that is coming our way about just everything that's going on in the world around us. Whilst we want to make sure that we check in on the news, try and limit your exposure to checking in just a couple of times a day, and then turn it off. Turn off your push notifications so you're not always having breaking news pitch up on your phone, because the temptation to click on it and to do something about it becomes really, really difficult to manage. It's important that we take action. We've spoken so much about how frustrating and confusing long COVID is. What we know from research is that one of the biggest precipitators of anxiety is a feeling of helplessness. So when things seem out of our control, it's important that to take back some of our control, that we do something to address the situation. So whatever it is that you feel like you can do, both passively or actively, whether it's taking on a hobby or doing some DIY thing that you can do, but it's important that you do something. The third one is reaching out. I've spoken already about how important social connections are. They're crucial in difficult situations. So if you can't see them in person, then connect using apps and technology, video conferencing, WhatsApp video calls, and so on and so forth. Get rose-colored glasses. And as a psychologist, I can tell you in 20 years, this is probably the opposite of what I usually advocate to my clients. But it's really important that when we look at where we're at right now, that we also look at the bright side of things. Because even in the face of these really hard times, as cliched and as trite as that advice might be, positive thinking, having the ability to reframe a situation in more positive terms, really does help people to become more resilient in the face of problems. So it's really important that we look at what good has come out of this as well, and not only focus on the negative. It's important to be patient. I've spoken about that already. Moving on from traumatic situations, as this pandemic has been, it takes time. And whilst not everybody has the same reaction to trauma, that for those that are struggling to deal with this, to navigate these uncertain times we find ourselves in, cut yourself some slack. It's okay for you to take time to deal with it. Set small goals. do things that you can do, like seeking help, speak to a professional, a mental health professional, speak to colleagues, speak to friends. It also serves to normalize our reaction, and we realize that we're not the only ones feeling this way. I spoke about a sense of helplessness that we feel and how important it is that we take control. One of the reasons why people are really struggling with the sense of anxiety is because they're trying to control things that they cannot control. So we cannot control how long this crisis will last. We cannot control how other people will react, whether other people take the vaccine, whether other people wear their masks or not. We have no control over that. We have no control over other people's motives or actions. We can't predict what's going to happen. But what we can do, what we can control, and that we should focus on, is doing stuff for ourselves, how kind we are to ourselves, finding things to do that give you that sense of achievement, that give you a sense of there is some normality in this craziness that's out there. We can control how we follow the rules. We can control our attitude. And those are the things, our actions, our behaviors, our attitudes that we should focus our energies on. And then we've also spoken about sleep and how that is one of the things to take a dive during COVID infection and also long COVID. So given the very real and tangible threat of the pandemic, it's very expected that our sleep is going to be disturbed. Our anxiety levels are at its peak. So cultivating healthy sleep is really important. And I don't think that I need to say why it's important, but just to remind people, having better sleep helps us navigate stressful times better in the short term. It also decreases our chances of developing sleep disorders in the long term. And it also helps to give our immune system a boost. And all of us can definitely do with more of that. So I've said already, and I will say again several times over, we need to limit our exposure to media to reduce our anxiety. Watching and scrolling through media really amplifies our anxiety levels. And I'm sure that you've heard this recommendation many times over it. It's backed up by research, so I'm probably not the first person to say this, but an excess of news and visual images about a traumatic situation also induces symptoms of post-traumatic stress disorder. So try to limit your COVID-19 media exposure to no more than twice a day. And you can decide when that is. I would usually recommend that you do it in the morning so you can see what has happened the night before that, and maybe before dinner. Certainly no more than 2 hours before bedtime. And I think that this is a habit that many of us have fallen into. I'm raising my hand here as well, because I want to know what is happening out there. What's the latest information to come out? What are the latest numbers, which are usually published around 8, 9 o'clock at night? But what happens is that when you go to bed with your device in your hand, reading through the news, and you try to fall off to sleep, or sometimes fall asleep with your device in your hand, what happens then is that that's the last thought you've had before you've fallen asleep. And our dreams, our anxiety is all centered around what we've read, what is in the frontmost of our mind. And it doesn't lead to a restful sleep. So it's really important that we switch off our devices at least 2 hours before bedtime, if possible. That includes your laptop if you work late into the night, and that you prepare yourself. You have a nightly routine that you go through, which I'll talk about just now. And then the other thing I want to say, which is certainly good advice for, try and promise yourself that you're not going to forward alarming headlines to friends and family and colleagues. When we're seeing what's happening out in South Africa right now, and it's not just about COVID, but also about the unrest and our political climate right now, we want to keep aware of what's happening. But when we get news that induces panic, we need to be careful that we're not forwarding this on, because it might be creating panic with other people who might not have the same kind of resources and the same coping strategies to be able to deal with it the way you might be able to. So be careful not to amplify and exacerbate anxiety within others as well. So going back to sleep and the things I spoke about, I've separated them into daytime tips and nighttime tips. The first one from a daytime point of view is keep a consistent routine. I've spoken about that a little bit already, but from a sleep point of view, it's really important that you get up at the same time every day of the week. A regular waking up time, it helps to set your body's natural clock. So it's called a circadian rhythm. And this is one of the ways our bodies regulate sleep. It regulates our appetite. So you wake up in the morning and you know it's breakfast time, your tummy starts to grumble a little bit. So it's really important that our body knows what our regular sleep routine is, what time our bedtime is, and what time our waking up time is. So it's really important to stick to these kind of regular schedules for meals, also for exercise and other activities. And whilst it might be a different routine from what it was like pre-COVID, it's important that whatever the routine is, that you find a rhythm that works for you and that you maintain it during this different normal kind of period, right? And that's not just for you, but also for other members in your household as well. If you have kids who might still be doing online learning, waking up at their normal time, so before COVID, and getting them into a routine of what they need to do is equally important, because it also helps you plan your day as well. It's important that you get morning light. We find that during winter, and I don't think I'm the only one, with the sun rising a little bit later, it's very, very tempting to stay in bed until the sun rises, where ordinarily we might be waking up earlier during the day. But when it's morning time, when your alarm goes off, or however it is you wake up in the morning, get up, get out of bed, open up your curtains or your blinds, get some light, because light is the main controller of our natural body clock. So regular exposure to light in the morning, beyond the benefits of vitamin D, really does help to set our body clock every day. And whilst natural sunlight is best, even on cloudy days, as it is in KZN today, it does provide double the light intensity of indoor lighting. So it's really important that you open your windows and that you get some natural light in. Exercising during the day, and even if you're not able to get to a gym or do an online routine, that you find the time to make sure that you're active. I've started to instill a pattern in my day that when I'm on a phone call, I try to walk around rather than sitting at my desk. I try to walk around when I'm on a phone call. And surprisingly, I've managed to get more than 10,000 steps a day. My Fitbit really enjoys that. But I realized just how much of my time I spend on the phone during the normal course of a day as well. So even if you're unable to actually do an exercise routine, to try and increase your step level or to do something that takes you away from your desk. Don't use your bed as an escape. I think it's really, really easy and very comfortable, especially if you're working from home, to sit on your bed under your duvet, have your laptop on your lap and try to get through your emails and your tasks like that. It's important that your brain recognizes your bed as your sleeping place. For those that use their bed as their living space, where they work on their laptops, or they lie in bed and watch TV or read the Sunday newspaper in bed, it becomes that much more difficult when you climb into bed and your head hits the pillow at night for you to automatically fall off to sleep, because your body doesn't recognize that I'm in bed, it is sleeping time, because that's your living space, not your sleeping space. To try and avoid caffeine late in the day, not just before bedtime, but from around dinner time, it's really important that you avoid caffeine. Caffeine is a stimulant and it will keep you awake and will interrupt your sleep patterns as well. And then helping others may also help with the feeling of uncertainty or unease. And altruism has really been shown to give us a sense of purpose. It reduces our feelings of helplessness. It alleviates some of the uncertainty that often contributes towards sleeping problems as well. So whilst we might not have too much time on our hands, when we are able to help others, even if all we're doing is just sharing information and not necessarily volunteering somewhere, it really does help to give us a sense of purpose. And then our nighttime routine tips: prepare for bedtime by having a news and electronic device blackout. This includes all devices, laptop, cell phones, tablets, television, all of it. It's really important, not just blacking out the news and other anxiety-provoking things, but also even if you're watching Netflix till the late hours of the day and night, binge watching on series, what it does do, and I think that this during the start of the pandemic had become our go-to for many people as a stress relief, knowing that we don't need to wake up as early the next morning because we don't have to commute to work if we're working from home, that our routines changed. So it's really important that we try and reassert some control into that. Don't spend too much time in bed during the night or daytime, as I've said. What I'm alluding to here is sometimes when you climb into bed and you don't fall off to sleep immediately, sometimes people will say that they spend up to an hour tossing and turning before they fall off to sleep. The right thing to do, if you find that you've climbed into bed and you haven't fallen asleep in
Carol Roots.
Join the meeting.
If you haven't fallen asleep in the first 10 minutes when you've climbed into bed, wake up out of the bed, take a walk down the passage, go get something to drink, look out the window, don't pick up a device, but do something else and come back to bed 5 minutes later and try to sleep again and repeat until you fall off to sleep. So it's important that you don't lie in bed tossing and turning, waiting to fall off to sleep. The next one, and I think it's a no-brainer here, minimize alcohol intake. Whilst alcohol is a depressant, it does lead to sleeping problems at night. And also it doesn't allow our brain to be able to categorize and deal with whatever stresses and experiences we've had during the day. So it's really important that our brain gets the time to do that, to file things away, so that when we wake up the next morning, we're rested and ready for the new challenges. And if you're having alcohol, then it kind of depresses that kind of brain activity. Set a regular bedtime. It's important that we fall off to sleep at a regular time, whatever that time might be that is convenient for you, and that you try and stick to that. So there's some level of predictability and routine. I've spoken about reducing stress levels and told you about things that we can control and things that we can't control. And then finally, from the tips point of view for sleep hygiene, is to create a comfortable sleep environment. And for each of us, that might be different. Some people need to have a warm duvet and to make sure that their hands and feet are warm before they go to sleep. For others, they're unable to sleep if it's too warm in the room, and dealing with the duvet becomes a real chore, and they need to have the air conditioner on. Whatever is a comfortable sleep environment for you is really important, because the more discomfort you experience, the harder it is to fall asleep and to stay asleep. So find out for yourself, analyze what you consider to be a comfortable environment and try and promote that. I've included in this a couple of step-by-step guide if there are any managers or supervisors on the call in dealing with long COVID. We find that we're traversing these kind of confusing and uncertain times with staff sometimes taking time off long beyond what we've expected. So it's important that you stay in touch with your employee whilst they're absent from work. Let them know that you're thinking of them In your first call, you might want to agree how you will stay in touch with the person. So how often you'll check in on them, whether they will call you or you will call them, whether it's via phone or email, and that they'll let you know when they're feeling better, when they're ready to resume work. If they're off from work, agree what you'll tell others and prepare for the person's return to work as well. So it's important that they understand what the expectation is. If they're going to be offered a duration, how do you want to navigate that? Do you need them to call in every single day? Do you need them to call in only when that time has expired? It's really important that you do that you hold a return to work conversation with them when they've returned, so that you can see how they are coping, whether there are any modifications that are needed to their work, current work tasks, whether they're equipped and able to deal with that to the extent that they have been previously. It might be useful to include HR during this time, and also during the conversation, take the time to check in with them, put them at ease, ask how they are, what they're worried about, try to explore solutions with them, those kind of things. Provide support during the early days of their return to work, both with you checking on them and also referring them to a professional if it's needed. You can imagine that there will be quite a lot of anxiety from their side when they've returned to work. Some of them might need you to assist with helping them with prioritizing things, scheduling things for them as well. We spoke about brain fog and how incapacitating it can feel at times, and then have regular check-ins to walk through and talk through with them how they're managing their health and work on an ongoing basis. So review regularly whether they're coping, because just because today might be a good day and they're coping, that does not necessarily mean that they continue to cope well. And they need to know that an open door policy exists for them to be able to raise their concerns with you. And then I'm going to end off with the way forward, because as an organization, I think companies need to ask themselves some really important questions. Do you know how many people?
Sorry, Zafia, you seem to have muted there.
I'm sorry, I was muted by someone. All right, so I think it's important that as an organization, people know how many of your staff have had COVID-19, have they had return to work interviews when they've returned, and how are they coping? Have you had to readjust the way in which you help them with their tasks? Have they had to adjust the way they do their work? What is the impact to the company for the future, considering the long-term impact that we're seeing with COVID-19? Are there plans in place for reasonable accommodation in the event of somebody not being able to continue in their current capacity? How are people being supported in the workplace in the short term, medium term, and long term as well? Oops, sorry. And what is the return to the new normal plan for people in your company? What changes do you need to make? And what support do you need with this, both in the short term, medium term, and long term, but both from a psychological and also practical point of view as well? Because we have to remember that the recovery time is different for each person. So we're seeing that with long COVID, the recovery time is not necessarily linked to the severity of the illness. People that have had asymptomatic COVID-19 or mild symptoms during their COVID-19 infection are also struggling with long COVID. So when there are ongoing symptoms that are causing people concern, that they don't discount that, but that they seek the help from their medical professional, they seek some medical advice. And whilst there's a huge push to return to normal, both on an individual level and from a company point of view as well, it's not so easy for us to just put this behind us, not from an emotional point of view, looking at the number of people, close people that we've lost, not from a psychological point of view when we're looking at how people are still dealing with depression and anxiety, and certainly not from a medical point of view as well. So we need to remember to go easy on ourselves and go easy on others as well, whilst we're coming to terms with this long-term impact of this pandemic. Thank you so much. That's my bit.
Thank you so much to Dr. Jenny and to Sophia. I think what we now need to do is we've got a few minutes to take some question and answers. We've got quite a lot in our chat box. So I will allow you to take questions. And again, I will bulk them into 3. Then if you can please address those questions and some of the comments that people have made. So we'll take 3 at a time and you'll reflect, answer those, address those, then I'll give you more questions. I've tried quickly looking through and scanning them to first start with the ones that are relevant in this specific section. And I think one of the ones that's very popular amongst our attendees today is they want to understand what the obligation is of employers regarding COVID-19 and its vaccine. So that's the first one. And then there's a similar question around what is the accountability or liability of the employer once they forced the employee to go and take the vaccine. So should the employee that was forced to take the vaccine become sick or dead, or they pass away, what is the liability that then sits with the employer? That's the third one. Sorry, that's the second one. And then the other question that I came across was the tips that have been shared around dealing with the psychological effects. Can those be applied and shared with people that are struggling with similar symptoms generally, or are they only specific to COVID? So I'll hand over to you, and then if you can please address those questions, then I'll give you another 3.
Okay, it's Jenny here. I'll start with the first 2 questions, which are around employees' obligations. So I think right at the beginning, when the government announced that there'd be a vaccine program, they said that nobody would be forced to take vaccines, and it would be a choice. And certainly the Constitution, people have constitutional rights to make decisions about whether they take medication or not. In the Department of Labour, then a few months ago, issued a directive, and the directive was around management of COVID in the workplace. And one of the issues they raised was whether companies would like to have a mandatory vaccination program. And if so, they would need to do a risk assessment, and they would need to get a policy in place. And only then could they actually decide whether a mandatory vaccination program would be relevant. And it might be relevant in certain industries, for example, the airline industry, for example, the healthcare industry, where healthcare workers are exposed to people, and people exposed to healthcare workers. It's a high area of exposure. And if people are working in offices, maybe those people need to be excluded from a mandatory program. It's a highly complicated field. It requires legal advice as well. If a company is going to institute a mandatory a mandatory vaccination policy, it is suggested that they do this together with legal and also with HR, because policies will need to be addressed, such as recruitment policies. You need to state up front that you have to have a vaccine, and how this impacts what happens if a person refuses to have a vaccine despite a policy. So there's quite a lot to take into consideration when deciding whether a company has a mandatory vaccine policy. It might, at some stage, I'm seeing with countries in the Northern Hemisphere, the United States and Europe, that some companies are actually instituting mandatory policies. So I think it's out there. It may or may not happen. Possibly will happen, but risk assessments do need to be done, and mandatory policies definitely need to be accompanied by having good policy with good HR and legal support. And the second question, what is the accountability of an employer if somebody who is vaccinated, I'm presuming under mandatory vaccination policy, has a vaccine and has a severe adverse effect, even as far as dying from the vaccine. So there is a vaccine injury fund, which is managed by the government, and this really will cover anybody who has severe adverse effects to the vaccinations. So it doesn't actually lie with the employer, but again, the employer needs to have this really well covered in their policies. I think the third one I'll hand over to Sophia.
Thanks, Jenny. Yes, so to answer the question about the strategies that I shared, these are strategies that can be used for any kind of stressful or traumatic situation, and in fact should be tips that we're putting into place as part of our daily repertoire of dealing with stresses. I started out saying that the same way that the COVID, I can't remember if I said it out loud or just thought it in my head, but in the same way that the symptoms with COVID and with long COVID is not only specific to COVID-19, the psychological impact that we're seeing, the depression and anxiety, the brain fog, the forgetfulness, all of those are also not only specific to COVID or to long COVID. So these strategies certainly can be used generally. Thank you.
Okay, thank you for that. The next three that I will take, Des asked, how do we deal with the overwhelming amount of disinformation which we're constantly being bombarded with? It's very difficult to ascertain what to believe most of the time. There are very learned people who are sharing information which is contrary to other learned people. So who do you believe and where do you go to verify the information that you're getting? And then there's a question from Yolette. Are there any free resources people can access for psychological support available to those who cannot afford it privately, especially trauma counseling and stress management? The next one we'll take. Lately, we experienced non-diabetic people diagnosed with diabetes after COVID-19. Is this permanent? That's the three I'll hand over, then we'll come back to the other three. We've got about 5 more minutes left.
Okay, I'll take the first one about the overwhelming disinformation. And I think this is really a huge issue, especially now with our COVID pandemic and people really getting confused by the information that's out there. What I can say, and I think Sophia did speak about this in her presentation, is you need to know where the information is coming from, and you need to trust information that's coming from reliable sources, such as in South Africa, we've got the SA coronavirus web page, the Food and Drug Administration, or the CDC, Center for Disease Control, or the World Health Organization. I think be highly skeptical of information that comes across on the social media, and as Sophia said, don't forward it. You know, a lot of it is mixed. Some of it is true and some of it's untrue, and it's very difficult to actually distinguish between truth and untruth. So really go to good, reliable sources of information, as well as your trusted doctor and people who in the healthcare industry who you trust and believe. But really try and shut off from all the nonsense that is circulated. And the second question was the resources. I'll ask Sophia to talk about that, but I'll talk about the diabetic. So I think we're seeing this increasingly, that people who get COVID and who are quite ill with COVID develop diabetes. And this is probably due to injury to the pancreas, which is the organ that controls the blood sugar in the body. Whether it's permanent or not is difficult to say. I think only time will tell, but very likely they will continue to be at risk of diabetes. They may be able to control some of it with how they eat and exercise and taking medication. But it's probably likely, if they have developed diabetes, that they were probably susceptible to it in the first place. but difficult to say, for me to say, not knowing the patient, but they might continue to be diabetic or what we call pre-diabetic or at risk of diabetes. So they will continue need to be careful their whole life. Sylvia, do you want to talk about the resources available?
Thanks. Yes, Jenny. Regarding the free access to support and to resources, I spoke a bit about the South African Depression and Anxiety Group. They have a national presence, they have an 0800 number, and they're quite well known, and they do really, really good work. With the advent of COVID-19, they set up many Friday talks where they had seminars that were available to anybody that would like to sign up on a number of topical issues, but you can also call into them, and they have support groups that run all around the country. Lifeline also did some talks as well, and also have, I think it's a 24-hour helpline that you can call into. There are many community clinics, so depending on where your area is, you might want to just check in with your provincial hospital where the community clinics are in your region that might also offer a free service or might have a nominal cost that you might need to pay. And then specifically around long COVID, if you'd like more information around that, I know that the University of Stellenbosch has a Professor Pretorius who's currently undertaking research on long COVID, and she, I suppose, is looking at the establishment of long COVID clinics nationally and the need for them. It's still very much in its early stages, but if anybody's interested, she does have a registry for anyone that is struggling with long COVID, and she's building up a repository of resources that people would be able to link to if it's specific around long COVID. Thank you.
Thank you. Another three. So there's a question around if I've been fully vaccinated and I get COVID again, what will I pass it on to other people, and how bad will the impact be? And then the other question that we have, please clarify the issue around leave when it comes to COVID cases. What happens in the case when employees' family have COVID, but the employee is negative? Must the employee stay at home? Is this paid leave or comes from annual leave? And then the third one, there are sources talking about 30 days and 90 days between when you were sick and getting the vaccination. So which one is which? Thank you.
Okay, thanks. So somebody asked about being fully vaccinated and then getting COVID, and what the consequences there are, and can you get COVID if you're fully vaccinated? So COVID, the vaccine doesn't actually stop you getting infected. You still can get infected, but what it does is it actually protects against severe infection and hospital admissions and deaths. And I think all the studies have shown that people who have been vaccinated, while they might be exposed to COVID and actually get COVID, they will be protected from severe COVID and death. The other thing is that their viral load, or the amount of virus that manages to start replicating in the body, is reduced when people are vaccinated. So while they still can pass it on, it's not that they're not going to pass it on, but the ability to pass it on is definitely reduced in a person who's vaccinated. I think that answers that question. And then on the 30 days and the 90 days, so they're all different countries. This is between but from the time that you've been ill to the time that you get vaccinated. So in South Africa, our Department of Health has stated that we need to wait 30 days from the time of vaccination. Some other countries say 90 days, but in South Africa, our rule is 30 days. So obviously that's from the time of recovery. So if you do have an extended episode of severe COVID and you are in ICU for quite a long time, and then you come home and you recuperate, give yourself time, and it might need to be longer than the 30 days. Some countries do 90 days. And then the other one is about leave. I think I'm not going to take that on because it will depend on the leave policy. And what you need to do is look at the company's leave policy. And if there are HR managers, it will be your role to actually decide how you're going to manage leave with COVID. So if somebody is exposed to somebody and they are what we call a contact, and we can do a risk assessment and decide if they're a close contact or not. If they are a close contact, they will need to isolate. And how that's managed in terms of leave at the workplace will really depend on the HR policies of that company. If they can continue to work from home, very well, they can do that. If they are required to be at work and are completely isolated from other people, and that's very unusual, they can probably possibly continue working, but they need to really follow the strict isolation rules for the 10 days of isolation.
All right, thank you so much for addressing those questions and comments. Once again, I just want to emphasize that we've had a lot of questions come through the chat box. Some of those questions and the comments were addressed in the presentations throughout this whole session. There might be some that have not been answered. We do apologize. It's because of the time constraints. However, they are noted. Again, this session has been recorded. It will be made available on the FEM YouTube channel. There's been a lot of requests from our attendees as well with regards to the presentations being shared. With permission from the presenters and our guest speakers, those will be made available depending on the permission that we get from them. Thank you so much. And then just to again extend my gratitude to Dr. Jenny and to Sophie. Thank you so much for such an informative session and presentation. There was a comment, Dr. Jenny, in the chat that said, oh, now I know I'm not crazy. So there really is something called long COVID. So I think it's something that people have been seeing happening, but then they didn't know that there actually was an existing condition that's called long COVID. So thank you so much for that awareness. And again, thank you for sharing the psychological and psychosocial impacts and the tips, very practical tips that have been shared. There's a lot that we can note as key takeouts from the presentations that happened today. We appreciate it, very informative. And that's the feedback that we've been getting in the chat box as well. Thank you so much in closing to everyone that has attended the session. Again, the recording will be made available. Thank you for the comments and thank you for the engagement. Thank you to our speakers and thank you so much to the team at FEM for facilitating and making this possible today. I think it is safe to now close the webinar and exactly at the right time that we had scheduled it for. Enjoy the rest of your morning and have a great Monday. Have a good week. Thank you. Goodbye.
Thank you. Bye-bye.